Hello, I'm Delanor Manson. I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. I'm delighted to be with you today to give you a little bit of an update on my visit to Washington, D.C. last week. The KNA is a constituent of the ANA, and we had our membership assembly last week, which is always really exciting. We have a Hill Day where we get to talk with our legislators about issues that impact nurses and Kentuckians. We had appointments and had the opportunity to speak with Representative Brett Guthrie, and he was phenomenal. He was so glad to see us, and he even remembered that I was a Navy vet and he's an Army vet. He poked a little fun at me when he said, "Beat Navy, that's okay. It never happens." So, Brett Guthrie asked us about the issues that were important to nurses, and we talked to him about, several things. One was improving seniors' timely access to the CARE Act of 2021. And we asked him if he would be able to support that, and he said, of course, it's the right thing to do. Then we spoke to him about advanced practice registered nurses and the registered nurses being able to practice to the full scope of their ability, licensure, and experience. And then last but not least, we spoke with him about valuing the nursing workforce in terms of the nursing shortage and making sure that we were addressing burnout for nurses as well as workplace violence. And he said that he would support us in any way that he could. Those all seemed like really good ideas for him to be on board with. We also had an opportunity to speak with the staffer for Senator Mitch McConnell, with the staffer for Representative Andy Barr, as well as the staffer for Representative John Yarmouth. We did not get the opportunity to speak with Senator Paul or his staffer. He said that he would make an appointment in June 20th or after, to speak with us about these same issues. The disappointment was that we did not get the opportunity to speak to Representative Massey, and we were really looking forward to it. Representative Massey, his staffer, let us know that he would not meet with organizations that supported mandatory vaccinations. We wrote him a letter and basically said that as a representative for his constituents, we wanted him to support the science as well as his constituents. And there are approximately 31,000 nurses in the state of Kentucky who are part of his constituency. We also wanted him to know that there are 89,000 nurses in the state of Kentucky, and that we are 53.3% of the healthcare workforce, which is a huge workforce. We wanted him to know that we wanted assistance and support on the issues that I mentioned that we spoke to Representative Guthrie about, but also the issue really was we needed to speak with our representative. And he said, or his staffer said, that he does not meet with any organization, nurses included, that support mandatory vaccines. And then, after our letter, his staffer wrote back and said, perhaps the reason that you have the nursing shortage is because of the mandatory vaccines and that you support that. How disappointing that our representative, who we voted into office, does not represent us. As nurses, we support the science. As nurses, the science tells us that vaccines save lives. And the idea that he wouldn't meet with us because he disagrees with our stance on mandatory vaccines is extremely disappointing. Extremely disappointing. And so, for those of you who are watching this video, please, please, please keep in mind those individuals that are elected officials that do not support nurses and do not support our viewpoint, but supports his own viewpoint. It's an opportunity for us to make our voice and our vote count. Vote for those people who will support nurses and nurses' issues, and vote for those people who will stand by us regardless of their personal opinion. And thank you.